So this depressive disorder is a 5 mark question in internal medicine. Basically, you need to know the clinical features and management, but I'll teach a little bit extra. So this is etiopathogenesis. So if you know this etiopathogenesis, it's important for depression. So depression means everything is depressing, that is decreasing. So everything, whatever you want, you can write 5-HT, norepinephrine, dopamine, BDNF, everything is decreasing. Nothing is increasing. Okay. So again, depression, that is less only. Something is getting low. So hope is getting low, help is getting low, and worth is getting low. Everything, the overall outside society and your own intrinsic sanity and others help immediate to you is decreasing. Hopelessness, helplessness, and worthlessness. So as you have seen in reels and all, when you get depressed, you go to a cat and hug a cat. So cat in Kannada is Beck cognitive triad. Okay. And another one is obviously grief. Okay, that is reactive depression, which you will know. Coming to the clinical features, think you have just final year RTHS exam just tomorrow. When your mother or roommate tells you to study, you'll tell, I don't have the energy or the mood to or the interest to study that idiotic subjects. So you sleep off. Okay. And anhedonia, before you were studying for your own understanding or anything, now you are studying out of pressure. So that's why you're not finding pleasure out of the exam. That is anhedonia. So after getting up from sleep, you realize that you're just a few hours away from the exam. So that time you'll get intense amount of guilt. That is pathological guilt. So you're awakened early in the morning and you will have sleep problems. You can't sleep out of that tension that you are getting out of the exam. And because of lack of sleep, you won't be able to concentrate on your studying. And as you will be partly concentrating, the sun rises and it will be morning, and you won't have time to eat also before the exam. That's why appetite changes. And in the exam hall, after you see the paper, it's so difficult and you will get irritated and get retarded. So such an idiotic paper. That's why psychometer changes. Finally, after the exam, you will fail. So that's why you will commit suicide. Okay. So this is the diagnostic criteria. 5 out of 9 symptoms are persistent or for 2 weeks. This is factual and you must remember this. How to remember the number? You think that just after the you sleeping, just before the guilt starting, these are the 3 and these are the 6. So the 6 is almost near to 5. 5 out of the 9 6. After you start getting guilt, everything depression starts. And our MBBS exams will be generally for 2 weeks, so you can think of pervasive for more than 2 weeks. And then these signs are given in marrow. So when you're about to suicide, someone stops you and takes you to yoga center. There you will do om, so omega sign. After doing om and meditation, you will become very good at studying. Very good sign, that is triangular diagonal folds. Further parts next video.